Chapter 25, the reproductive system, part 2. So we are going into the female reproductive system. The internal organs include the ovaries, right and left ovaries, the uterine tubes that are near the ovaries, and then we'll carry the oocyte to the uterus, and then of course the vagina. The ovaries have an outer layer referred to as the ovarian cortex. Within the ovarian cortex is where you will find the follicles. And follicles are the structures that house the oocytes, the egg cells. Then, of course, there's also a center area of tissue referred to as the ovarian medulla. This inner area has lots of blood vessels, nerves, lymph ducts, the things that the ovary needs to stay alive, because after all, it is a living organ. And then, of course, there is the hilum. The hilum is the area where blood vessels, nerves, etc. enter and exit the ovary. Then we have the uterine tubes. Uterine tubes will carry the oocyte that's released during ovulation from the ovaries down to the uterus. It does this by having cilia lining the surface of the uterine tube. The cilia will beat, generate a current in the fluid that is carrying the oocyte, and it will gently drift down to the uterus. Also, the uterine tube is often the site of fertilization, so sperm often make it into the uterine tube to fertilize the oocyte. It's worth noting the uterine tube is not directly attached to the ovary. It is near the ovary, but not attached to it. The uterine tubes have these little finger-like structures that are covered with cilia called fimbriae. The fimbriae help to generate that current that helps to carry the oocyte into the uterine tube and eventually to the uterus. The uterus can be broken up into three main regions. The top portion is referred to as the fundus. Main portion of it is the body, and then the inferior portion that pushes slightly into the vaginal space is the cervix. Fundus, body, and cervix. The uterus is an extremely muscular organ, so it has lots and lots of smooth muscle tissue. If you look at the uterus in layers, you've got the outermost layer, the superficial layer called the perimetrium, just connective tissue that forms the surface and also is where blood vessels and nerves can lie on the uterus. The middle layer is the myometrium. Myometrium is a thick layer made of smooth muscle tissue. And again, it is the contractions of the smooth muscle tissue that help to induce the infant to leave during childbirth. And then the innermost layer lining the inside of the uterus is called the endometrium. Endometrium has two layers. It has a functional layer that lines the inside of the uterus and gets sloughed off during menstruation, and then a slightly deeper basal layer that is always present and will reform the functional layer. Cervical cancer. Cervical cancer is cancer of the cervix. It can be detected because initially the cervix will start to change shape or get a little larger or whatever. The cells will become abnormal in appearance. Sometimes these abnormal cells return to normal. Sometimes they will become cancerous. So to detect cervical cancer early on, a woman will get a pap test where they take a tissue sample from the cervix and look at it under a microscope to see if the cells are abnormal in size and shape. The HPV, human papillomavirus, which causes genital warts, has also been linked to causing many, but not all, cases of cervical cancer. And now there's a vaccine for this virus, for HPV, and it has shown that to work and actually is decreasing the incidence of cervical cancer in young women. All right, and then that brings us to the vagina. The vagina is a tubular fibromuscular canal. It has little ridges within it, little rugae, important because the vagina is able to stretch, especially during childbirth. And then at the vaginal orifice, there is often in a female, at least as an infant, a bit of extra tissue, slightly closing, but not completely, the vaginal orifice. This is a thin fold of the mucosa layer, the innermost layer of the vagina. Moving on to the external genitalia. The external genitalia of the female is collectively referred to as the vulva. The vulva includes the mons pubis. The mons pubis is directly anterior to the rest of the vulva, and it is a mound of adipose tissue, fatty tissue, and pubic hair. Then we have the clitoris. The clitoris is a small cylindrical mass of erectile tissue. Then we have the two folds of the vulva, the outer labia majora folds that are thicker and possess pubic hair, and then the inner thinner folds called labia minora that are thinner, devoid of pubic hair and fat, and usually pinkish in color. And then, of course, you can also see the urethral opening and the vaginal opening, which are two separate structures because the reproductive system and the urinary system in females are separate. All right, oogenesis, the production of the egg cell, the oocyte. Well, we start off in what are called primordial follicles. Primordial follicles each house a single primary oocyte, which has 46 chromosomes, 2n that is. The primordial follicles develop when the female is a fetus, so before they're even born, all the oocytes they will have are produced. And then meiosis will begin at puberty, occurring basically once a month. The primordial follicle will move on and enter the meiosis process, oogenesis. When that happens, we will have primordial follicle become a primary follicle. This is triggered by the hormone, follicle-stimulating hormone, causes the primordial follicle's outer cells surrounding the oocyte to divide and grow, making the primary follicle thicker and bigger than the primordial follicle. Again, happens about once per month, is the start of the ovarian cycle, and at this point we still have 46 chromosomes in the oocyte. It has not entered meiosis yet. The follicle will continue to grow and become what's called a secondary follicle, becoming larger, more cells outside of the oocyte growing and developing, and also starting to produce the hormone estrogen. And then eventually the secondary follicle will become the mature follicle. The mature follicle has a large space filled with fluid. The oocyte at this point will now divide. We'll go through the first division of meiosis, leading to a oocyte with 23 chromosomes and most of the cytoplasm. The other cell that has 23 chromosomes and very little cytoplasm is discarded, and of course estrogen is still being produced. Ovulation is the release of the oocyte. The mature follicle will rupture, releasing the oocyte plus some cells surrounding the oocyte out into the pelvic cavity, and then the cilia beating on the fimbriae of the uterine tube will gently pull it into the uterine tube and send it down along to the uterus. The trigger to cause ovulation is a dramatic spike, a dramatic increase in the amount of luteinizing hormone in the female's bloodstream. Fertilization, as we mentioned, occurs in the uterine tube primarily. When fertilization occurs, the oocyte will undergo the second round of cell division, again giving us one cell with most of the cytoplasm and 23 chromosomes, another cell with just 23 chromosomes, very little cytoplasm. That cell gets discarded. And then after that, the sperm will actually fuse with the oocyte. So what happens to the tissue that made up the mature follicle after ovulation? Well, it will then develop into a structure called corpus luteum. This yellowish structure in the ovary, corpus luteum, lasts for about 14 days, and it releases the hormones estrogen and progesterone. And then if after 14 days there is no pregnancy, the corpus luteum will degrade and just be a little bit of scar tissue. So, meiosis and oogenesis. Oogenesis, we have the stem cells. The primary oocyte is developed when the female is a fetus, and it'll exist in the primordial follicle. Childhood, eventually puberty happens, and once a month, hormones will cause the primordial follicle to become a primary follicle, and then a secondary follicle, and then a mature follicle. It is this stage that the primary oocyte with 46 chromosomes divides to become oocyte with 23 chromosomes and an extra cell that's discarded. Then ovulation occurs, and then if fertilization and only if fertilization occurs do we get the second round of cell division, when the oocyte divides into one oocyte with 23 chromosomes and most of the cytoplasm, and one with 23 chromosomes and very little. That extra one is discarded. Then we get the fusion of the sperm with the oocyte, giving us a fertilized egg cell with 46 chromosomes. All right, the mammary glands. The mammary glands are the structures that produce and synthesize the milk needed by the infant. Have, of course, the nipple. The nipple has a pigment, is the pigmented projection that sticks out, and within it is closely spaced lactiferous ducts, little openings where the milk will emerge. Around the nipple is the areola, the pigmented circular bit of tissue. Within the breast, of course, we have plenty of adipose tissue and connective tissue to give it its structure and shape, and then also the mammary glands. The mammary glands are made up of smaller structures called alveoli. Each individual alveoli produce the milk, secrete the milk, that then travels through ducts to a slightly widened area called the lactiferous sinus that can store a tiny bit of milk, very little, very minimal amount. For the most part, the milk is produced and secreted as the infant suckles. So the breasts are not designed to store milk, but to produce it when needed. Disorders associated with breasts and female reproductive system includes breast cancer. Breast cancer is the second leading cause of death from cancer in women, usually occurring later in the woman, so usually 30 years or older, usually older. When a woman gets to a certain age, she will need to do an annual mammogram where they use x-rays basically to detect thicker, denser tissue. So it's very sensitive x-ray film. And so, for example, here in this view of a breast, the white area here is where a potential cancer has been found. There are lots of different treatments, chemotherapy, radiation therapy, lumpectomy to remove the cancer, and the most dramatic treatment is radical mastectomy, where the affected breast is removed along with the underlying pectoral muscle tissue and the axillary lymph nodes, because that is usually the first place that breast cancer travels to if it starts to metastasize. All right, we will stop here and come back to the female's hormonal cycles in part 3.